What's up, y'all? It's Celeste, and as you can probably tell, I am now post-op. Today is Wednesday, and so I had my surgery yesterday, and I'm back in the rental now, and this rental is really fantastic. Like, it's pretty much ideal for recovering in because you can't see the entire chair that I'm sitting in, but it's like this enormous chair that's like almost big enough to be a love seat, but it is a chair, and it's got this huge ottoman, and so I'm able to just like sort of lean back in it, and I have this neck pillow that I have here right next to me, and I can just do this and put my feet up and just sleep right here. And it actually is a lot more comfortable than you would think. I was really worried about sleeping on my back and also sleeping sitting up because usually that doesn't seem very comfortable, but it actually was not bad at all. So this just opened, I guess, so you can see now my bandage, and I am using my little drain pouch that I made, and don't worry, I'm not going to pull the drains out, so the drain bulbs or anything, you don't need to see that. But it's working really well. I'm really glad that I made it because when I first got home, I didn't use it, and the drain bulbs were just like over next to my side, and so whenever I would like put my arm down, I felt like I was kind of pressing on them, which probably is fine, but it just was not as comfortable. And so this keeps them all like totally centered and everything. So it's definitely something I'm glad that I made. So I really don't want to have to spend too much time editing this, so I'm gonna try to make it so that I can just talk and not have to edit it too much. So sorry if I get kind of rambly, but the pain right now is well, actually, I just took my pain medication, but I was able to, let's see what time it is. I was able to push it an extra, I think 2 hours. Yeah, 2 hours past where I could have taken it. Um, so I've been taking it fairly frequently, like on the schedule, but I'm trying to stretch it out a little bit when possible because I would like to not have to be taking it for too long. I'd like to be able to switch over to just regular Tylenol or something, but it definitely hurts. Even after I take the pain medication, it still hurts quite a lot, but that makes it more manageable. Um, Basically, just feels like I got beat up or something. I will say that the pain is like it's a strong amount of pain, but it's all like localized to this area. It's not like the whole rest of my body pretty much feels fine. Like I'm able to walk around and stuff. I mean, I'm a little bit weak, but um, I mean, if I were able to move my arms around, like my arms themselves feel fine. Excuse me. Obviously, I can't like move them too much because I'm trying to not to raise them. But I mean, other than this area, like I really feel pretty okay, and I've been surprisingly alert. Other than like off and on, shortly after I take the pain medication, usually I get kind of tired. But yesterday when I got home from the surgery center, I thought that I was going to be like totally out of it because other surgeries I've had in the past, which I've never had like a major surgery, but I've had a bunch of oral surgeries, and I had a rhinoplasty and tonsillectomy, and so I was under general anesthesia for all of those. And all of those, like, it took me a long time to wake up, and I was just like really out of it and just kind of like just really drowsy and just kind of like loopy and stuff for a while after it. And with this, I really wasn't. I guess I should probably backtrack and talk about yesterday because I haven't really done that here. Excuse me. I have a little bit of congestion, I think, from the bandage and just from, I don't know. I tend to be really congested anyway, but I think it's from the bandage. But I've been trying to breathe deeply as often as I can because that can help prevent fluid buildup and everything. But anyway, so yesterday I was supposed to be there at 10:30, and my surgery was supposed to be at 12:30. Well, like I said in my last video, I pretty much expected it wouldn't actually happen at that time, and it didn't. But the problem with that was that I got a migraine yesterday, which I also pretty much knew was going to happen because um, because not drinking and eating is like a huge migraine trigger for me. If I go too long without like getting dehydrated or without eating, I tend to get a migraine. And I couldn't eat or drink anything yesterday. And also, I wasn't able to take anything for the migraine. Like, once I could tell it was happening, there I couldn't take anything. So I kind of knew that was going to happen, but I was hoping that, like, if I could just get there at 10:30, and then, like, hopefully they would take me back pretty quickly, and I could, be able to get something to help me with it. But unfortunately, even though I checked in at 10:30, they didn't actually take me back until almost 12. So I was sitting in the waiting room, feeling really bad, and my head just hurt really bad. But then I also started to feel kind of nauseated, because that's definitely something that happens with me for migraines. And so I was getting kind of worried. And so finally, my mom went and asked the people if there was any way they could take me back, because I just wasn't doing very well. And they did. It took them another, like, 15 minutes or so to clear a bed and everything. But once they took me back there, I still was in a lot of pain, but it was better than being in the waiting room, because there were a lot of people in there, and there was, like, coffee, which, like, the smell was really strong, and it was kind of messing with me. And they had the TV on, and it was just like, there was just, like, a lot of sensory stuff that was not helping my migraine at all. And obviously there was a lot going on in the back too, but it was like, once they put me in my little section, I had a curtain and I had a bed, and I was able to, like, lie back and somewhat relax and everything. And let me tell you something, every single person at the surgery center, like, I could not have asked for better people taking care of me. It was so, like, such a great place, and everybody there was so compassionate and so kind and everything. And they really were fantastic caregivers there. But unfortunately, I still wasn't able to get anything for the pain, because I hadn't even had the doctor come by yet or anything. So I basically just kind of, like, lay there and just tried to sort of relax as much as I could, and, like, tried to kind of go to sleep if I could. And I never actually went to sleep, but I was kind of, like, sort of half conscious basically. But finally, Dr. Garramone came by and marked me and everything, and he was super, super nice. And he basically just, like, had me stand up and marked on my chest, which you can see the very top of here, where he marked me. And he showed me, like, once that he marked me, he had me look down, and he showed me, like, where everything was going to be and everything. And he drew on his glove the size of the areola and the nipple, and basically just kind of gave me an idea of what to expect. And he asked if I had any questions or anything, and then that was pretty much it. So then he left. I did mention to him that I had migraine, and he said that when the anesthesiologist came by, that they should be able to give me something. So finally he came by, and he was also super nice, and he gave me some fentanyl, which unfortunately didn't do a whole lot. It maybe possibly made my head feel a little better, but it still hurt pretty bad, and I still had the nausea feeling and everything. And but I was trying to just, like, lie there and, again, just try to kind of go to sleep. And I felt like I was almost asleep, and then just all of a sudden I just, like, got this wave of nausea. And I guess, trigger warning, I'm not going to say anything graphic or anything, but I could feel that I was, like, about to throw up. And so I kind of, like, threw up a little bit in my mouth, and I didn't have anything there, but they had given me a call button, so I was able to get somebody to bring me an emesis basin, although by that time, like, I didn't throw up again, so I didn't really need it. But anyway, so that was a little worrisome. But after that happened, they gave me some Zofran, and I can't remember what the other thing was. They gave me something else for nausea, and I guess those helped, because I didn't really feel too much nausea after that. Sorry, I'm rambling a lot, I know, but I'm just trying to, like, remember the course of events of yesterday and everything. But so it wasn't too long after that, I guess, that they finally took me back. But the reason that everything got pushed back was just because one of the surgeries earlier in the day took longer than expected, and so the time that I was going to be going in for my surgery, the person before me was, like, just going in. So basically everything just got pushed back. So I was supposed to start at 12:30, and I didn't actually go until 3. So it was a pretty decent delay. But like, I really wouldn't have minded that if it hadn't hadn't been for the migraine, because that just was like not fun at all. But on the other hand, like in a way, I guess that made it that gave me like a distraction, so that I really just wasn't anxious at all, because I was just so concentrated on the migraine that there wasn't any opportunity really for me to like sit there and like psych myself up or out about the surgery, because I was just like so focused on the pain of the migraine, that I just was like kind of half out of it anyway. So I guess that was kind of good in a way, in retrospect. But so anyway, they took me back, and by the way, one interesting thing was that everybody who came in, like every new person that came in and introduced themselves, like all the nurses and the nurse anesthetists and the anesthesiologists and everything, asked me if like what I wanted to be called, like if the name, like my legal name, all the paperwork was what I wanted to be called, or if I had some other name or whatever. And I also noticed that Dr. Garramone, when he was talking to my mom about me, used they, them pronouns. So I thought that was kind of interesting. He never actually asked me what my pronouns were, but I guess he assumed, since I'm non-binary, to just go with they, them, which was fine with me. And a few of the other people used he, him, which I had heard ahead of time that that they're all kind of just like trained to do that with all of Dr. Garramone's patients, so that didn't bother me. But anyway, that was just kind of interesting. And let me think. What was I even talking about? Sorry, it's a little hard to breathe also with this on, so kind of getting a little out of breath talking for so long. What was I saying? Oh yeah, so they took me back, and they just like wheeled me into the operating room, and like right before I got in, like when I got to the door, they went ahead and gave me some sedative, and so then they took me into the room. That was another interesting thing, because like every other surgery I've had where I've had general anesthesia, they've put the sedative in and then like have me count backwards from 10 or something, and I get to like 8 and I'm basically out. And this wasn't that immediate. It probably took like maybe a minute or something, but like I was awake while they took me into the room. They had me move over onto the actual operating table, and then it seems like I have a vague memory maybe of them putting the oxygen mask on, but I don't actually know if that actually happened, or if like I dreamed about it later or something, but that might have happened. But that's basically all I remember. And then I woke up in the recovery room, and that was kind of different too. I don't know if it was just a different kind of anesthesia that they used or what, but like other times I've had trouble waking up where like I felt really groggy, and like I don't know. This time it wasn't like I bounced awake or anything, but it was kind of like when you wake up and you're kind of like aware that you're now awake, but you're not really ready to like wake up, so you're just kind of like half aware of what's going on around you. Like you can hear other people talking, and you're like sort of half paying attention to that, but you're also kind of still resting. So that's basically how it was for a little while. And then somebody came, I guess the nurse came then after a while and checked on me, and she had me move over into a chair. I guess it was kind of a recliner or something. And she gave me water and apple juice and some crackers. And then while I was doing that, she showed my mom how to empty the drains and how to check them, like measure the amount of fluid and everything. And that was basically it. Then she just helped me up, and I was actually able to walk out to the car, which again was like the first time, because every other time they've always wheeled me out. Even if I didn't necessarily need it, it's just like a protocol thing that I thought was fairly typical for surgery centers. But this place, I didn't need that, so they just had me walk out, and then got in the car, and I was like pretty alert by then. I was like tired and stuff, but I don't know, I was pretty with it. And so then we got home, and unfortunately, shortly after we got home, trigger warning again, I did throw up again. And then I guess I probably just got here, and I guess maybe I just went to sleep after that. Maybe I had some crackers or something. Seems like maybe that happened. And we didn't actually get home until like, well, I think we left the place at 6 something. So we probably didn't get here until 6:30 or 7. I don't know, sometime between then. So it seems like I just kind of like rested here for a little while. I know I didn't actually go to sleep until like 10, but my mom slept in the living room here with me last night. She's going to sleep in the bedroom tonight, but you're supposed to have somebody actually in the room with you the first night. Um, and so we got up every few hours and had me take my pain medication, my other medications and stuff, and she took care of me, everything. And unfortunately, I did throw up one last time at around 10. It was like right before I went to bed. I don't know. I think that was all just from the anesthesia. I was really worried that it was from the pain medication, and that it was going to be like an ongoing problem. But thankfully, that was the last time. So I think it was all just from the actual surgery and the anesthesia. I haven't had a problem with it since, so things seem to be doing pretty well. Overall, I'm doing really well, other than being in pain. But that was to be expected. And like I said, it's a lot of pain, but it's manageable. And like honestly, compared to the migraine, it's not like this isn't that bad of a pain. It's just it's not as debilitating as a migraine for me. When I have a migraine, it's like the pain is like so strong that like I can't even pay attention to anything else. I can't like do anything else. And with this, like it hurts a lot, but I'm still able to like sit here and talk to you, like even though it's hurting a lot. And like I don't know. I mean, migraines have a lot of other effects too, like cognitive and neurological and stuff. But anyway, sorry. I know this is like going on and on, but I just didn't want to forget anything. And I don't know. I don't really know what else would be useful for you guys to know. I'm trying to remember what other people said in their videos that I found useful, because I definitely watched quite a few that were from people like right after they had the surgery, like the day after. Trying to think of any other tips or things that would be helpful. Maybe I'll think of those for the next video. But I haven't been able to like take an actual shower or anything, obviously. Theoretically, I could take a shower of my lower half, but I think that would just be really hard to do without getting the bandages wet, so I'm probably not even going to try that. But we did use baby wipes all over me today, and that seemed to help some. I don't feel that dirty now anyway, because like I haven't been outside and I haven't like gotten sweaty or anything, so I mean, I'm not really that dirty, but it's kind of hard for me to do certain things, and there certain things that like I don't know if I should be doing. Like I can do them, but maybe I shouldn't be. It's hard because I'm in so much pain like all the time that it's not like I can tell by the fact that I'm in pain that I shouldn't be doing something. So certain things like turning the water off and on, it does take a decent amount of force for me to do that, and I have to use both my hands to do the faucet. And it just like I can feel that I'm using I can feel some of the like force or like some of the muscle usage around my chest area. So I'm trying to be careful with it, but I mean, I have to be able to do some things by myself. So I don't know like how far I should push it and how far I should like just wait for help. I mean, I'm not trying to like overdo anything or whatever, but I can't have like somebody do everything for me. So yeah, so I haven't so far had a huge problem with itching or constipation or anything like that. It's only been one day, so you know, that kind of stuff could happen at any time, but so far so good other than the pain. So I guess that's probably enough for this video. I'm sure I'll have more tips or info or whatever in the next video. I just really wanted to try to remember as much as I could about the actual surgery experience and the first night and everything like that. I guess I feel like it was kind of not as bad as some people's experiences were, because I know that some of the people that I watched said that it was like they got hit by a truck and that like they couldn't sleep at all the first night. And I didn't really have that problem at all. I was kind of in and out during the night, but it wasn't like I was. It wasn't even like I was like going from like awake to asleep. It was kind of just like that thing where you're kind of like, again, like sort of half awake and then like kind of go back to sleep, and you're not really sure exactly like where the lines are between those. It's just kind of like that, as opposed to when you're like asleep and then you know that you're awake and you're kind of stuck awake for a while and then finally you go back to sleep. It wasn't like that. So it wasn't that bad. But maybe harder than some people's experiences, or maybe harder than some people made it out to be, but not harder than I expected. So I don't feel like I was like blindsided by this or anything. But if you have any questions, of course, you can always put them in the comments below or message me or anything. I'd be happy to answer questions about pretty much anything. And you can message me if you want to keep it private or whatever. That's totally fine. And if you're okay with me answering your questions in a video, then you can mention that. Maybe I would answer them in my next video or something, or whenever you ask the question. But I think that's probably it for this video. I know I already said that like 3 times, but yeah. So I guess I'll probably make another video. Probably not tomorrow, maybe in 2 days or something. I don't know, if something monumental thing happens tomorrow, maybe I will, but it'll probably be a couple days because there's not really that much to report here. But if you like this video, give it a thumbs up and subscribe to see more of my future content. Thanks so much for watching, and I'll see you guys next time.